Now, when it comes down to Black and brown mamas, potential risk to the pregnant mom and her fetus, there is no data that indicates the vaccine should be Hello. Welcome if you're new here. I'm Dr. Tiffany Woodus, and I'm a wife, a mama, and a board-certified OBGYN on a mission to help eliminate women's health disparities. Today, I'm going to attempt to answer your questions about whether or not Mocha mamas who are pregnant, breastfeeding, and trying to conceive should consider receiving the COVID-19 vaccine. In order to help us answer this question, there are a few important things we need to consider. Number one, what is the prevalence of disease activity, or how common is the disease in our community? Let's take a look at the numbers.
This morning, patients on stretcher after stretcher, jamming ER hallways outside the traffic jam of ambulances that delivered them. Providence St. Mary's Hospital in Apple Valley, California, hasn't been below capacity for weeks.
I believe we have about 57 to 60 patients right now that are ICU level care in the hospital.
And how many ICU beds do you typically have?
We have a 20-bed ICU.
So they're basically you're at 300% capacity for your ICU.
Yes, that is correct.
Across the country, over 113,000 Americans are hospitalized with COVID, setting a record for the 11th straight day. And a new record also set overnight for deaths. A staggering 3,400 people. The nation's current epicenter, California, reporting over 53,000 new cases. Dozens have spent days waiting for rooms at this hospital, about 90 minutes from L.A. Many of them are desperately ill, and some, charge nurse Jamal Willis tells us, are dying.
Just this morning, we ran multiple colds back to back. We had 3 cold blues at the same time. One of our doctors went up and ran those colds.
Meaning people were having a cardiac arrest?
Cardiac arrest, no pulse.
At the time of this recording, and today is December 17th, 2020, 16.7 million cases have been reported in the United States, with just over 300,000 deaths. Here in Texas, where I am, 1.3 million cases have been reported, 84,000 of which have occurred in just the last 7 days, as well as 24,000 fatalities. The next thing you have to consider are what are the risk and the potential disease severity for pregnant mamas. In order to help us answer this question, let's revisit the information I shared in the COVID holiday tips for pregnant mamas video. This month in November 2020, the CDC recently updated pregnant women to the high-risk category for COVID-19 illness. Study results released just this month show that pregnant mamas had significant increased risk for ICU admission, mechanical ventilation, and death from COVID-19. Pregnant mamas who suffer from comorbidities such as hypertension, obesity, diabetes are at even greater risk for significant disease. I'll link that episode in the cards above, which you can check out later for more information. Some additional factors to consider is that we have seen some research that looks at the risk of what's called vertical transmission, which is the passage of the virus from the mama to the fetus via the placenta during pregnancy or during delivery or while breastfeeding. Now, the studies from these reports are conflicting, but the consensus seems to be that the risk of this occurrence is extremely low. We've also seen some research that suggests that mamas who are infected with COVID-19 are at increased risk for preterm labor. Now, this is an area that requires more research. When you get down to the nitty-gritty of these studies, there is some information that suggests that there could be other factors that are contributing to the increased risk of preterm labor that we see for these mamas. Now, when it comes down to Black and brown mamas, we know that we've seen an increased risk of prevalence for this disease in our community. We've seen more severe disease in our community and an increased risk for death. Now, we've spent a lot of time on this platform talking about the factors that contribute to these findings, and they include things like social determinants of health, pre-existing underlying medical conditions, systemic racism, differential access to quality care and services, and historic and persistent inequities in our healthcare system. Now, the next thing we need to consider is what do we know about these vaccines? Now, at the time of this recording, and again, today is December 17th, 2020, the Pfizer mRNA vaccine has been granted emergency use authorization for prioritized groups, which at this time includes healthcare workers and individuals who reside in long-term care facilities. Now, stay posted. You probably heard today that the FDA met to discuss the Moderna vaccine, which will likely also receive emergency use authorization very soon. Now, these vaccines are mRNA vaccines, also known as messenger RNA vaccines, which is not a live vaccine. They work by using our cells to create a protein that's found on the coronavirus. Our body then mounts an immune response by creating antibodies that protect us from the COVID-19 virus. Now, you cannot get COVID-19 from the vaccine, nor does it have the ability to alter our DNA. Now, currently, the Pfizer vaccine is intended for use in individuals aged 16 years or older. It's a 2-dose regimen given 21 days apart, and the efficacy or level of effectiveness, how well the vaccine works, is 95% after the second dose is administered. Now, this is very similar to the Moderna vaccine, which we anticipate will be released very shortly. This is also a 2-dose regimen vaccine, this time given 28 days apart. This vaccine is indicated for use in individuals 18 years old and older, and the efficacy of this vaccine after the second dose has been quoted at 94%. Now, the next question is, what do we know about the safety of this vaccine for use in pregnant and breastfeeding moms? Now, there are no safety-specific data for the use of these mRNA vaccines in this particular population, and the potential risk to the pregnant mom and her fetus is actually unknown. Now, based on what we know about how these messenger mRNA vaccines work and the safety and efficacy profiles we see in the clinical trials, scientists have concluded that the safety profile and efficacy profiles we see for pregnant moms should be very similar to what we see for the population in general. Now, it is important to note that there is no data that indicates the vaccine should be contraindicated in pregnant and lactating women. Studies in pregnant women are planned. Preliminary studies are underway. The evidence from these preliminary studies indicates that there have been no major safety concerns. Now, it is important to know that more than 40,000 individuals participated in the clinical trials prior to the emergency use authorization of the Pfizer vaccine. Now, about 10% of those individuals identified as Black, and about 26% of those individuals who participated in the clinical trials identified as Hispanic or Latinx. I also want you to note that most study participants experienced mild symptoms after vaccination. This included things like injection site reactions like mild pain, redness, or swelling at the injection site, fatigue, chills, muscle pain, joint pain, and headaches. Now, these are expected routine reactions that we would see as the body is mounting an immune response and creating antibodies to protect us from the virus. Now, I also want you to know that there were no steps skipped in the development or evaluation of the COVID-19 vaccines. The same rigor and standards that are typically applied to the vaccine development process applied in this case as well. The speed at which these vaccines were developed has to do with a massive amount of money that was thrown into these projects, as well as combined worldwide efforts. You also need to know that safety monitoring is ongoing with various surveillance systems. Now, given this information, ACOG, or the American College of Obstetricians and Gynecologists, recommends that the COVID vaccine should not be withheld from pregnant individuals who would otherwise meet criteria for inclusion in the prioritized groups. Individuals wrestling with this consideration should have access to the available safety and efficacy data, as well as data that is not yet available. A conversation between the patient and their clinical care team can be helpful in assisting with making this decision, but should not be a requirement prior to receiving the vaccine, as well as a pregnancy test should also not be required prior to receiving the vaccine. ACOG also recommends that the COVID-19 vaccine should be offered to lactating women just the same as non-lactating individuals. The potential risks associated with the vaccine do not outweigh the benefits of receiving the vaccine. As such, there is no need to either avoid breastfeeding or discontinue breastfeeding once an individual receives the vaccine. When it comes to individuals who are trying to conceive, ACOG recommends vaccinating those individuals. They also state that it's not necessary to delay pregnancy in an individual who has received both doses of the vaccine, nor is it necessary to delay receiving the second dose should an individual become pregnant after receiving the first dose of the vaccine. The second dose can be administered according to the current vaccination schedules. At the end of the day, your decision boils down to weighing the risk and benefits. You have to consider your individual health status and how that would affect your outcome should you become infected with COVID-19. You need to consider your risk for exposure, whether it be at home, at work, or in any other environment. You have to consider your risk for exposing high-risk individuals in your family or in your home as well. These conversations must take into account your personal values as well as cultural considerations, especially when it comes to our community, which has a deep-seated history and medical injustices that have eroded the trust of the Black community. And these injustices go far beyond the Tuskegee syphilis experiments of the 1970s. I'm talking about a long history of experimental exploitation of Black Americans that include, but are not limited to, unethical enrollment of Black individuals in experiments that had an unacceptably high death rate, subjecting our community to experiments without our consent or knowledge, performing medical or surgical procedures on Black Americans while they were unconscious or under anesthesia. Think the Mississippi appendectomies of the 1920s to as late as the 1980s. If you need a more recent example, think about the recent whistleblower evaluation we heard about regarding the unacceptably high rates of hysterectomies performed in ICE facilities around this country. I could go on and on. So let's revisit the original question, which is, should Mocha mamas who are pregnant, breastfeeding, or trying to conceive consider receiving the COVID-19 vaccine? The choice is entirely yours. We will support you in whatever decision you feel is best for the health and well-being of yourself and that of your family. I will encourage you to look at the data, lean into reliable resources, have these discussions with your healthcare team. Make sure that your team sees you, hears you, respects your personal values, and your cultural considerations. It is the responsibility of our healthcare team to re-earn the trust of the Black community, and I am here to help facilitate those conversations. Please do not hesitate to reach out to me if I can answer any questions or concerns for you regarding this. If you choose to decline the vaccination, make sure that you remain vigilant about prevention measures such as social distancing, hand washing, and mask wearing. That's it for today, ladies. As always, I appreciate you. Take good care and stay healthy, friends. If you enjoyed today's video, I have a whole channel of more videos just like this one. Do not hesitate to like, share, subscribe, and I'll see you on the next episode. Take good care.